So many people ask me, what do I do? Whether in a seminar or on TV, I do the same thing. I give people hope by getting rid of their pain.
If you have a pain in your body, this is the guy to ask the questions to and talk to about it. He's the authority on pain management, and I want you to meet Mr. Tasso Spanos. And we're so glad, sir, to have you with us tonight.
Nice to be with you tonight, David.
I was at a seminar probably 4 or 5 weeks ago down in Sir Wickley, and he was demonstrating this technique to many of the people that were there that had pain. And of course, I'd had trouble with my hip for the last few years, off and on, and I would go to a chiropractor, and it would relieve it for a while, and then it would come back, and I would go back to the chiropractor, and we just did this off on thing. And so that particular day, I had been several weeks of really hurting, and so Lori came and got me. She said, "You got to go meet this guy." And so I came in, and we talked for a few moments, and he said, "Lay down the table." And I laid down the table, and he did a technique, and literally in less than 5 minutes, I got up off the table and was pain-free, and haven't had that problem since you did that. And I looked at him at that day. I said, "You got to be on the show," because I was just so impressed with what with his technique. Tell me a little bit about this technique that you use.
Well, I'm a muscle specialist. Now, other people do muscle work, and there's chiropractors who treat some muscles, physical therapists who certainly treat muscles, occupational therapists train muscles, massage therapists massage muscles, and there's people who do Rolfing and Traegering and Feldenkrais. These are all muscle therapies. Now, what's the difference between me and these other muscle therapies? The word trigger point. I'm a myofascial trigger point therapist. And so my focus is on a trigger point. Discovering the trigger point, treating the trigger point, deactivating the trigger point, because I'll tell you, it's like a little time bomb waiting to cause problems, and then giving a person a stretch to maintain them. Most of the stretches we recommend can be done easily by the person at home with the same high rate of success. A muscle is a lot like a bungee cord, and the further you stretch a bungee cord, the further you stretch the bungee cord, the stronger it is. If you stretch it from here, this far, it's extremely strong. If you stretch it just a little bit, it's less strong. So anything that reduces the length of this bungee cord, makes it weaker. Well, you have an operation, and you have an appendectomy operation, and they cut you to get to the appendix, and they create a little knot in the muscle, and it's not normal there anymore. So now this knot is making this shorter. Well, what's one little knot? That's the difference between being 40 years old and being 55 years old. You're a little weaker. You can see this is going to make this weaker. So then you have a whiplash, and in a whiplash your head moves, and then it stops, and then you create another trigger point, and now the muscle is shorter. So you can have a chill. You can have a huge air conditioning hitting a muscle, shortening it, causing and creating a trigger point. And now we're getting these trigger points, and these trigger points are not normal to have them. But the muscle is normal. Is here, it's normal, and it's normal there, and it's normal there. But this does not add to the strength of the muscle again. And now it's beyond just being a little older, David. Now you start having a pain. Here comes the big problem. The pain is not where the muscle is. It goes someplace else.
The pain's not where the muscle is.
That's correct. 95% of the time, the muscle and the pain are in two different areas. The X's is the cause of the pain or the trigger point. The red is the pain. And you see that the pain is not where the trigger points is. So anything you do to the red area, massage it or whatever it is, you might make the person feel better for a little bit, but it won't stay because it's really coming from there. I had the great fortune of studying 9 times with Dr. Janet Travell, who was President Kennedy's doctor in the White House. Now, if you have to understand, Kennedy at 37 years old was on crutches every day for 2 years. He had a bad hip that hurt, couldn't put his leg on the floor. He had a bad left knee that hurt, couldn't put that on the floor, and there he is on crutches, swinging around the Senate. And finally, he got so bad that he didn't go to vote on any bill for 7 months because he was busy taking his broken body to different doctors looking for help. He met Dr. Travell, that was my mentor, and in 2 days, in 48 hours, she got him off of the crutches. Media producers love me. The audience won't shut it off, and ratings go up when viewers realize that their pain can go away. I can do a lot of things in 5 minutes because I start working on the right spot and I don't waste a lot of time working on the wrong spot. Here's a tip. You put a pillow between your knees, which takes some pressure. So everybody says it keeps your spine straight. Yes, it does. But what it really does, it keeps you from squeezing the muscle I'm about to work on. So there's two muscles, and one muscle is this. This muscle is called quadratus lumborum, and it's attached to the last rib, and then it's attached to the hip. And I'm treating the attachment on the hip and the attachment on the rib. But this is not just one little spot. This attachment's 5 inches long. So I'm looking along that 5-inch thing for the knot. It's the whole muscle's not bad. Remember I said if the whole muscle's bad, she couldn't walk in the room tonight. So something must be working, but something isn't working. And if you try to load this muscle up with work hardening or strengthening exercises, while it doesn't have enough range of motion, while it doesn't stretch, it makes it worse because you end up ruining what still is working. So before she said her hip hurt her here, and now does not hurt. So that's not, no. So that spot's better. And what happens is the spot that is not as bad shows up, shows up. How about in here?
No, but you're getting to...
Right there.
To it, yeah.
So this is a paraspinal. This is a muscle that can make a pain go down to her waist. She doesn't have her hip pain anymore. She has a pain in her waist. Now bend over. And that's an exercise that's on the video, and I'm going to give her these exercises tonight. Okay, now come up. Now, I want you to stand up now. How's that? Is it gone now?
Oh, yeah.
It's gone. So she had two pains. She had a pain here that she complained about, but once this pain was gone, it was gone. And then this pain was there, but it wasn't as strong, but it showed up when the other pain wasn't there, see? There are no liability issues with our seminars and shows. We're not drawing blood. We're not prescribing drugs. Everything we do is non-invasive, and they see immediate results. Their pain is gone. Tell me, where does your neck hurt? That's a big place.
In through here, and then in through here.
Okay, does it, now I want to ask you a question. Does it go down? You're back here, this far.
Almost that far, yeah.
How about, is it more up here?
Yeah,
It's
and
more
then
up here.
down through.
And then down lower also?
Yeah.
Does your hand ever hurt you here?
No, but my hand goes numb.
Your hand does go numb. And
Yeah.
are you tender when I touch your chest there as compared to this side?
Right there.
Yeah, it's tender. You have something wrong with a muscle called the scalene muscle. It's the right side that hurts a lot, doesn't it?
It was the left side, but it's transferred to
the
the
right.
right side because
Okay.
I had nerve block done on the left side.
Now, this muscle's attached to her neck. It's called the scalenes, and for those who remember their geometry, it's named after the scalene triangle of geometry, which has 3 sides, which are all not the same length. So, is this tender in here?
Oh, yeah.
Okay, and I'm touching you again like this. So the trigger point is not an acupuncture point, it is your injury spot, which might vary an inch from another person where they got their injury spot, but it's similar. So here we go. So this muscle has 3 parts to it. And we then take that and I lengthen that muscle. But there's 3 of these suckers in there. Hold that for me there, David, okay? And so I change her head and I bring her head up and I bring her to the sides. See, I got her moving further this way, but that isn't the same as this muscle at this angle. See, that's tight now, so I work on that muscle. I stretch her this way. Now I bring her chin up. Now, I think she has another muscle. I think she has 2 muscles that are bad. I think she has a muscle called levator scapula because she's indicating she has a pain at the top of the shoulder blade, and also it's creeping up her neck and making it difficult for her to turn her head. So how are we doing that? Now, how's the pain in the middle of that back? Is that gone?
Yeah, it's gone.
Viewers surf the channels. When they see real people getting help, they connect and they stay tuned. Tell me about yourself. Do you have a back pain?
Yes, I do.
Okay, where's your back pain?
L1 to L5.
So he says his is different. Look where we're going, everybody. He says he has a pain from L1 to L5 in a straight line?
Yeah.
Okay, so you don't have a pain across your back. No. That would be a tummy muscle called rectus abdominis. He doesn't have a pain on his hip. That would be a quadratus lumborum. He has a pain called the psoas. Now, how long have you had this pain?
9 years.
And have you had any surgery or anything for this?
Yes.
And did the surgery help?
No.
So that means that wasn't what was wrong with you. So he has an abdominal muscle, has a pain pattern of a groin pain or a back pain that goes up and down. So I'm looking for a muscle that's attached to his spine from T12, L1, 2, 3, 4, and 5 spines behind the stomach. Behind the stomach. How deep is that? Pretty deep. It's all the way in. That's right. Pull it again. But where's the other part attached? To the thigh. So it's hard for, what's your first name?
Mike.
Mike. It's hard for Mike to believe that this muscle here, Mike, is a stomach muscle. But it's the other end of it.
I do feel looser.
Is the pain less?
Yeah, somewhat, yes.
Somewhat. I have treated thousands of people, including major sports figures and politicians. I can quickly diagnose the problem and keep the show moving, whether it's on stage, on TV, or radio. What's up, dear? They're so cute. They come up and I said, what hurts? And they go, what
doesn't hurt?
What, all of me? All of me, they said. No, all of me doesn't hurt.
Here.
Right there. Wow, you're kidding. So it's the bottom of the shoulder blade.
Well, it's right in there.
Right there.
I'm having it a little bit now, but not like...
Not as usual, because it comes and goes.
And then I'll get a cramp here.
Okay, now, does it go across or does it sort of stay right there?
It stays right there.
Now comes, this is important. What's the size of this pain? Is it about the size of a quarter, or is it about the size of my whole fist?
50-cent piece.
50-cent piece. Do you have trouble breathing? Have you had pneumonia or bronchitis in the last 5 years?
Never.
All right. Let me see you take a deep breath. Looks pretty good. Just one or two muscles that could be bad. Now, this muscle can be irritated by a broken rib, operation on the ribs, cancer in the ribs. Don't be worried about that. Or most people get this bad from deep coughing, as in pneumonia, bronchitis, or asthma, or allergies, or emphysema, where when you cough, when you have those conditions, you don't cough like this. You
secondhand smoke.
Well, you could, but anyway, you start coughing like this, like you're trying to dislodge something, and that's how this muscle usually gets bad in most people. Now, it makes a pain about the size of a $50. And it also can make a pain not by the breast, but under the armpit. So do that away. Now, see if that feels better back there. Is that better?
Yes.
Huh?
Yes.
Is it gone?
Yes.
It's gone, so, okay. Regardless how severe the pain may be at the time, if it's muscle-related, the pain goes away.
It's across my shoulders, it's arthritis, and up to in my neck,
Come over and sit here, honey.
and it gives me terrible headaches.
Okay, starting in the middle trapezius. She has trouble with practically, I would say, anytime you ever see anybody massaging anybody, they're always massaging the top of their shoulders.
She's having a hard
She's having a
time.
hard time.
Oh, that hurts.
That hurts.
Oh,
That's because I'm working on the wrong spot. I'm working on the wrong spot. It's coming from the back. I can't tell you how many parks I go to, and I see the boyfriend, I take their hands from working up here where it doesn't work, and I move their hands to the middle and low back. And it's the middle and low trapezius send problems to the top of the back, to the top of the shoulders. Once it gets in there, it travels up the back of her neck, and once it gets there, it goes to there, and once it gets there, it goes over the top of her head. So that's the pattern. And when did you have the fall, dear?
Oh, my. It was before 1979.
Where'd you find all these people, David? I mean, you know, I go to some places, I've had this pain for a week. It's really driving me crazy. Watch this now. The trouble is, anything you do to the top of her shoulders makes her worse, because the pain in the top of her shoulders is not coming from the top of her shoulders.
I also went to a chiropractor for pinched nerves in the bottom of my back.
Well, you could have a pinched nerve, but I don't think this is it. Here. See, I want to show it to her first. See, I know you don't have your glasses on.
No.
You see that X?
Yes.
Okay, that's where I'm going to work. See where it's red? That's what you're complaining about, isn't it?
Right.
Is there any X in the red?
No.
That means the red isn't coming from there. It's coming from where the X. Tender, isn't it? Feels good, though. It feels different than treating the pain spot. How long do I hold? I hold until it softens. What softens? The knot. What knot? The knot that doesn't show up in the MRI. How can we tell the knot's there? I can feel it. How can she tell the knot's there? It's tender. If I stay in the muscle, and if I move away from the knot and treat the muscle here, it's not tender. It's only tender there. She says it's tender there, and I feel the knot there. And what we're doing, reducing. Now here's her exercise. She takes her hands, and she puts her hands together. She's going to have a tough time with this, because she has been, this is 30 years now. 79, 89, 99, 99? Yeah, 30 years. Now try to get your